In this video, you'll get a quick overview of Vibrant's Food Allergy Panel. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. Vibrant's Food Allergy Panel measures IgE antibody levels to 12 of the most common food allergens, including milk, egg, shellfish, peanut, and wheat. Food allergies are increasingly common. Nearly 11% of adults and nearly 8% of children in the US have at least one IgE-mediated food allergy. That's approximately 33 million people. Globally, we're talking about 220 million people. In fact, recent data suggests that between 1.1% and 10.8% of the global population has a food allergy. The top 9 food allergens ranked from most to least likely to cause a reaction includes milk, eggs, fish, crustacean shellfish like crab, lobster, and shrimp, tree nuts like almonds, walnuts, and pecans, peanuts, wheat, soybeans, and sesame. In comparison, Vibrant's food allergy panel includes cow's milk, egg white, egg yolk, tuna, crab, oyster, shrimp, English walnut, peanut, wheat, soybean, and corn. Vibrant's food allergy panel is a serum blood test collected via venipuncture. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of one antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and dice the wafers into tiny microchips, then arrange the microchips, one for each antigen, on a 4x4 or 10x10 grid atop one pillar on a 24 or 96 pillar plate. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. Let's start with a quick overview. The food allergy sample report is 3 pages long and includes a cover page and then lists all 12 markers. Note, as is the case for all Vibrant America tests, there are no interpretive comments for Vibrant's food allergy panel. The cover page identifies the sample type and includes the results interpretation key. The full report lists the IgE antibody levels of 12 food allergens, including cow's milk, tuna, crab, shrimp, oyster, wheat, corn, peanut, soybean, egg white, egg yolk, and English walnut. Note, total IgE is an add-on test and not included automatically. The results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. So, which patients benefit most from this test? Well, patients with known or suspected food allergies, patients with a family history of food allergies, patients complaining of nasal congestion or runny nose, hives, rashes, an itchy mouth or ear canal, swelling of the lips, tongue, and/or throat, trouble swallowing, shortness of breath, or anaphylaxis. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there is more than one root cause contributing to your symptoms. In addition to the food allergy panel, consider adding total IgE to assess for total IgE immunoglobulin levels. Also, consider the food sensitivity test that measures IgG4 and C3d. This helps assess for immune tolerance to positive IgE foods, since IgG4 can act as a blocking agent for IgE antibodies, and also C3d can assess for complement activation. And finally, total immunoglobulins, which includes total IgE, total IgA, total IgG, and total IgM, to assess for hypo or hypergammaglobulinemia. Total immunoglobulins is crucial because serology testing is based on normal, functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is especially helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, Vibrant's food allergy panel uses highly specific and sensitive microarray methodology to measure IgE antibody levels to 12 of the most common food allergens. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.